Germany is preparing for a potential second wave of the coronavirus pandemic with the creation of fever clinics dedicated solely to COVID-19 testing in hospitals and health centers across the country. As correspondent Mia Alberti reports, the goal is to separate those with potential coronavirus cases from the rest of the patients in medical centers to avoid outbreaks.
After 2 days of coughing and fever, Anya is getting a COVID-19 test. She wants to make sure she won't be a risk to the clients at the shop where she works.
I was worried because I'm always in contact with many people, and that's why I got the test.
This is what's called a fever clinic, health centers dedicated solely to testing patients like Anya with COVID-like symptoms. The goal is to separate potential coronavirus cases from the rest of the patients in medical centers.
This way we can protect the patients, our staff, the doctors and the nurses.
Since March, 2,000 people have come to this clinic and 200 have tested positive. This doctor expects the next few weeks to be even busier.
For 4 weeks we had no patients, now we have patients again. We definitely need this for the winter because we won't be able to tell right away if a patient has the flu or the coronavirus.
The number of coronavirus cases in Germany has been rising in the last few weeks. Germany wants to continue using testing as a power weapon against the second wave of the pandemic. The government has announced a testing program in schools, the purchase of quick tests, and the expansion of the fever clinics project.
In the last 2 months, Germany has doubled its testing capacity. It's now testing more than 1 million people per week, and fever clinics are part of the strategy to increase that number even more and control local outbreaks during the winter. There are many other fever clinics like this one already operating in Germany, but the government wants to make sure that centers like this are available nationwide as soon as possible.